back in because who's going to keep
Good
time and
evening,
what's
good evening, good evening, and welcome to Couch Conversations where health is wealth. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the doctors. Tonight, we're going to have a special conversation with Joe Harrington and Congressman Davis as they create a safe space for all to ask their questions with a special focus on men. So, guys, and we have an extra guy that just joined us. So, guys, take it away.
No, you got Dr. Miller,
yes,
who is also with
a
us.
guy.
So we have a bona fide physician who is a health practitioner.
Yeah.
So, so we are fortunate. I tell you, I'll start um, this conversation, and I guess I'll start it this way. I sometimes use Ozempic, and so I went to pick up my Ozempic the other day, and I said I don't want to be without it because I use this mail order thing. At least my insurance company uses it, and I don't like it. I just use it because sometimes the mail may not come when you expect it. So I
Mhm.
said I don't want to be without it. So just send me a prescription over to Walgreens, and my physician did. And I go to pick it up, and the lady say $500.
Mm.
I said, "Well, I got authorization from my health insurance outfit that I can. It's approved." And she said, "Well, give me your address and your name," and I gave her all of that. I said, "Now what is it?" She said, $539. I said, "Let me call the insurance company and see if this is accurate." I did and had two, three conversations. I like to try to know things. And every explanation they gave me, it was still $539. Now, I pay a lot of money every month for insurance, plus 500. And they said, "Well, considering your age and all of the other things that could be wrong with you, it's $539." And that's what it is.
Mm.
So when people talk about the cost of health and the cost of health insurance, anybody who thinks this is just BS,
Mm. No.
that might be what they think, but it's for real. In addition to the premium that I pay about $1,000 a month, I gotta have this other $500 for this equipment that I use.
Mhm.
So I think when people say we've got to try and figure out a way to reduce the cost of health insurance, the cost of pharmaceuticals, it's real, and it's a real deal. How do we do it? What will we do to do it? And I've never yet met anybody yet, and we have all these highfalutin conversations. The most knowledgeable people in the industry in the world. We still have not come up with the way that we can get approved and make use of to reduce the cost.
Mm.
So I consider myself a health practitioner of sorts in terms of having studied it a long time. and in terms of having been involved with lots of research efforts, at least where conversation was going on. And I've not seen it go down yet. Matter of
Mm-mm.
fact, it keeps going up. So, gentlemen, thank you so much. Welcome. And please go right ahead.
Yeah. Well,
Thank you for opening the door. I'll take a crack. And I see, Dr. Miller, did you freeze? Seemed like you jumped
no.
up and
Okay.
then you froze. You're back.
Yeah.
Well, okay. Yeah. Well, one of the things, and I think I want to begin and pick up on what you said, Congressman Davis, about our healthcare system. I have a cousin who was born and raised in Chicago, graduated from Hirsch High School, eventually wound up getting a PhD, now lives in Paris, France, is a professor in Paris, France. He loves living in France, loves the people, he loves the country. He had prostate cancer last year, and he was pleased to tell his family that he had prostate cancer. Not only did he have cancer, he had excellent treatment while living in Paris, and more importantly, he never saw a bill.
Mm.
He got universal care, universal access. I had prostate cancer last year. I had a series of treatment at a hospital that I worked at Rush University Medical Center. I have Medicare. I pay for a Medicare supplement. So I already have Medicare. I pay for additional coverage over and above the Medicare. I still had to pay out of pocket. One of the things that Dr. Mason always would say is we don't have a healthcare system. He refers to it as a disease detection and management. Then what we do is we detect disease, but the money is in managing a disease. And so it's a different approach to healthcare in this country. That there's a lot of money being spent for people to manage their conditions. And even people with so called good insurance have what they refer to as out of pocket costs.
Yeah. Well, I think as you look at that system, I think a couple of things we really have to look at, and one is who run the system, and how does the system um, relate itself to doing and providing the care that people need, and does it really gives is it really concerned about the care of people? And I think when we start looking at that, and we look at how it's ran by people that are in the business to make a profit. That's their objective, is to make money. And so when that becomes your driving force, as long as you're making money, you'll continue to do the things that will make more money. Now, when we say, well, how do we cut the cost? First of all, we gotta do several things. First, we got to start preventing some of the disease processes. Second, we got to make certain that when we manage the problem, that we manage them in a way that where we don't put people for their care in the highest cost environment. In other words, if it costs more money to take care of a patient in the hospital, then our concern need to be, where can we provide that? How can we provide that care and keep people in a setting that is less costly? And so, and who controls it? So when the controller is not that concerned about the people that are receiving the care, because they feel that we are in control, and we don't have to really worry, because we are writing the rules and we are paying those that are carrying out the rules, so they're in total control. So I think that that part of that is how do we get a little bit better control over the insurance companies? That's one of the things. And the other thing is, how do we get people and train and teach people how to be better managers of their care and their health. And so that means teaching people at the right time, because if we wait until people get diseases to start to intervening, then it's going to cost more to take care of those problems, as opposed to if we were doing something earlier, early detection. We can probably we can probably be more successful with getting cures. Early detection, we probably be able to put people in situations where we can treat them for less money, and then also just really controlling, because some of these things that we're paying for, people in other countries are getting the same thing for less money. And so we got to look at those things. Why is it that they are able to get the same thing, the same drug that we're talking about, and they pay less money? So that means that it can be gotten for less, but we're not really we're not that's not happening for the people in this country. And so I think that we got to figure out ways to make certain that we get to that point of managing, that point of making certain that the negotiation and the bargaining in terms of drugs, uh, drug costs, is done in a manner that better controls how much we spend.
Next week, of course, we will be celebrating the life and the legacy of Dr. Jesse Jackson,
Mhm.
Reverend Jesse Jackson, philosopher Jesse Jackson, athlete Jesse Jesse Jackson, great thinker Jesse Jackson. And as people, I've heard lots of people evaluating or trying to evaluate the influence and the impact of Jesse Jackson. And, almost every person have whatever their take is. And I always say that Jesse Jackson had so much influence on things not just in this country, but in the world. And there are some people who can't get a handle on how that influence came about. And they don't place as much value. I've been to two big health rallies in the last 3 weeks. One, there was more than 1,000 health workers on a Sunday afternoon right here at Homan and Roosevelt Road
Mm.
in what used to be a drugstore, Walgreens store there, and they went out of business. But I was so thrilled and delighted to see these 1,000 people on a Sunday afternoon in the heart of North London, having a rally trying to get the Illinois General Assembly to pass legislation so that the health centers could get discounts and the people using them could get discounts on their prescriptions. And I'm wondering what a person who doesn't have this $539 to pay that I just paid at Walgreens for my prescription. And then I had another prescription that was $79.30. So that totally comes out to be more than 600. Last week, I spoke at another event that the National Association of Health Centers had their annual gala in Washington. Well, it was actually in Virginia. The two speakers were Newt Gingrich and myself. And I was surprised to hear Newt Gingrich talk about needing to change our system from what we're talking about as healthcare
I hear him.
to
Should I click the other box on the side?
sickness care,
Mm.
and how the system that we have is, as Dr. Terry Mason talks about a great deal, that we treat sickness more than we deal with health. And and I was surprised to hear Newt even get to the point of talking about that, because that would not have been Newt 20 years ago.
Mm.
That wouldn't have been Newt Gingrich when he was swearing me in as a member of the House. And so this business of change and how change is a slow, in many instances, and subtle process. And it takes the long distance runner that Jesse used to always talk about. And he would say he was a long distance runner,
Mhm.
knowing the change he was seeking was not going to happen next year, but it might be over the next 10 years. Or when Dr. Martin Luther King say, I may not get there with you,
Mhm.
but I do believe that we're gonna get to the promised land. And so if generations keep fighting the same fight, you will eventually perhaps get there, but you can't give up. You have to give out, maybe, but not give up. And then the baton has to be passed on, and somebody else got to take it and keep running and keep running. And sometimes those who would be part of organizing don't realize that, and they get disappointed when they put time, energy, and effort in and don't see the change that they thought they would see.
Mhm.
And so I guess if we were trying to convince people, we'd be trying to convince them to just keep going, keep going, keep going till you give out and still believe that it's going to happen. You just won't be there when it occurs. And I think understanding being and organizers, you feel better about it because you understand that that's how it often works.
Yeah. Congressman Davis, I'm going to jump in. Nikki asked me to say hello to the Core Center because I guess they're looking, they're watching, and they're part of this moving forward. The Men in the Basement, the Garage, to Linda Johnson, Carrie Still, Audrey Jaycox, and Pat Dow. And Angel Underwood sent a comment on Facebook and also on Instagram. This is her comment. It says, we definitely have to put more focus on healthy eating and living, including limiting stress in our lives.
Mhm.
And I see Dr. Terry Mason has joined us as well.
Muted. Terry, you're muted.
You're muted, Terry. He'll get there.
Yeah.
So, but again, Aubrey J. Cox talked about healthy eating and as we talk about these things, maybe I'm going to toss it to Dr. Miller, and what would he suggest in terms
Yeah,
of what people do? And our diet guru, Dr. Terry Mason, will hopefully join us soon.
yeah. Well, I think again, we talk about prevention. How do we prevent? How do we? And again, we're talking about health. And I think as has been mentioned here, the problem that we're doing is not doing the things that will promote and maintain health, but we're just treating illnesses, and that's always like being behind the eight ball. You're behind on you're never going to catch up unless you get even and then get in front of the problem. Then you have a chance to. And so eating is part of the process that we need to deal with, because much of the diseases that we deal with are sometimes are often related to the things that we consume and how it's prepared. So eating the food that we eat and how that food is prepared is such an important and big part of what causes the problem. And so again, we have to deal with resolving the problem as opposed to just trying to maintain the results of the problem, the in organ damage from the problem. You're not going to keep, you're not never going to get in the front of a problem if you're always trying to just resolve the things that result from it. So eating is such a big part of that. Eating, exercising, getting proper sleep, reducing the stress in your life, having some loving relationships in your life. There's a whole number of things that we as people need to have in order to have a healthy life. And so as we look and one of the things that I will see when I look back on in time, um, at my grandparents, they had their issues and problems, but it seems as though that the daily stress was a little bit different. It was a little bit different in terms of how they dealt with it. They had relationships with one another. They had community involvement. They had they showed care and concern for one another. And I think that these kinds of things are things that help to relieve some of the stress that people are dealing with, because we always say, well, just you gotta cut the stress down. But if people don't know how, then telling them that is really not going to help them to achieve what it is that you're asking them to do. And so part of that is helping and teaching people how to resolve some of those things and how to prevent some of those things from creating the difficulty that we're concerned. And we're all human beings, and regardless of what we do and say, stress is going to be there. And when there are things that are piling up on us, just like the congressman was talking about, he go to the drugstore and he got this big bill for his medication. What about the guy that goes and can't afford to pay for that medication? And I've had experience with people that could not afford it, and they just did not have the money that they could afford it. And oftentimes they would come back, and I would evaluate them, and I sometimes noticed that things are not as well as they had been the last time, and we would discuss it, and I've come to find out, well, instead of them taking a medicine daily, they were taking it every other day so that it would last, and so that was their way of making certain that they had something, but not having what they needed. So those, so when we're dealing with those kinds of things in our society, people are going to be stressed, and they're trying to deal with that. And it doesn't just go away because we wish it to go away. It goes away when some of those stressful situations, some of those stress causing events are removed from people's lives, and so now they're able to get the rest and the relaxation that they need. Getting in bed doesn't mean that you're sleeping. If you're still anxious and concerned and worried, you can be in bed 8 hours but only get 2 hours of sleep. And so we got all these kinds of things that we're dealing with, but certainly food is everybody has to have food. You can't survive if you don't eat. You're not going to maintain, you're not going to live. But it's also important that you eat the things that you need to eat. Now that becomes an issue as well, because people, certain food costs more than others. A lot of the processed foods, a lot of those kinds of things may be less expensive, but they are not healthy as eating fruits and vegetables as people need to. But sometimes people resolve the first thing that bothers them is, I'm hungry. I need to do something about my hunger. And so what can I afford to to put on my table so that I'm not hungry? Because that's the first thing that I'm dealing with. My body's telling me I need to eat, and I can't afford to eat the things that I should be eating. So I'm going to eat something that costs less. So these are big problems in terms of how we of cost of healthcare. And I'll tell you another thing. And when we look at a person with, for instance, with just a problem like high blood pressure, and we look at the cost of the medication, and we put all these things together. I remember having a project once when I was supposed to look at what does it cost to treat and control high blood pressure versus what does it cost when someone has high blood pressure that's not treated. And we looked at not just the cost of the medication, the cost of their physician visit, and we looked at that same person who did not have the medication and suffered in organ diseases, which have maybe stroke or heart attack. And so you had to add that into the cost, because if you don't take the medication, now the other problem becomes another cost. And now a person who may be able to be is no longer able to be productive and provide provide the needs that his family need, because he or she has had a stroke or heart attack. And so all of these things has to go into the cost consideration when we look at that.
Yeah, I'm going to pick up on some of what you said to move the conversation along. And,
Hey,
and you
Joe?
talked a lot about
Joe,
Yeah, go ahead.
I just want to make sure.
Yeah, we
I was just making sure I could be heard. That's all.
okay.
But I wanted to add a different perspective to this. First of all, in America, we have no value proposition on health.
Mm.
Everything that we do is managing disease. From one point of view, we try and there, I'm not saying that's not important, because disease needs to be managed, but we need to understand that the money that what we do as a physician, we are trained to be people who manage disease. That's what we do.
Detect and manage.
I'm sorry?
Detect and manage.
Yeah, well, detect and manage. Detect means to define what the problem is, but then try and manage a disease as best as we can. And the money in the medical profession is in disease management. There's no money per se in people eating the way they need to eat, because if we did, we hopefully would get people to do better. But the real problem is that our system, if we look at how much we spend for medications, how much we spend for the different therapeutics, how much we spend for a lot of the new things that have come out, and how costly they are, and do we put a real test to those things to see, do they actually cure something? Maybe it manages it, but does it actually cure? And even our medicines that we get over the counter, yes, there are medicines like we need to take. I'll give you our water pills for that are used in our high blood pressure management. That's never going to make your high blood pressure go away. We don't teach people, and I've not been taught when I was in medical school. And I would dare say that probably all of us that have been taught in Western medicine have not been taught on how to actually work on curing and preventing disease. We get told how to manage it, but not how to get rid of it, because there's no money in getting rid of the disease. The money is in managing disease, over and over and over and over again, which then, and I'll stop here, which we still need to have that cooperation between the physicians and the patients, because one part can't do it all themselves. But we do have to do something different than what we're doing, because what we get now is not working.
Yeah.
It's not working. The people are not getting better. They may get improved, but we need to really think far more around how can we get rid of these diseases, or how can we prevent them from ever happening, so we won't have to spend out the tremendous amounts of money that we're spending. And obviously, food is a big part of that. We could talk about that another time, because much of what we eat is creating a problem. That's why I suggest everybody go watch Forks Over Knives and watch Game Changers and those two movies to just get a better appreciation. And then there's another movie called that was put out some time ago, and it was a real good critique of the food industry in terms of the things that we're getting that are actually making it worse. And so I'll put those next time when we have a chance, and even Congressman, if they want, we can even set up a time where some people, if they're interested, because I've got a bunch of men now that have been watching a lot of movies, like what the other one that I'm thinking about is called What the Health. It's an old movie, but it asks the question, what the health? What are we doing? And it really digs into and shows that the foods that we're eating are not only causing our diseases, but many of them, the things that we're taking, will never get rid of them. But there's no real energies around that. So I'll stop right there, because that's the conversation we need to have.
Yeah, go ahead.
Yeah, a couple of things. And Nikki's been texting me, and she wanted me to let people know that Angela Underwood sent a comment on Facebook and also on Instagram. Her comment says, we definitely have to put more focus on healthy eating and living, including limiting stress in our lives. She also wanted us to share how grateful we all are for the life of the Reverend Jesse Lewis Jackson. And I think that goes for everybody that's joined this program tonight. And there are several people we need to say hello to. Albetus Winfrey, Donald Dew, Carl Brinson, Elon Johnson, and I apologize if I mispronounced your name, Dr. Travis, Trashawn McCoy, Renell Perry, Lou Sias, Bonnie Smedley, Ken Jordan, Miss Roz, and Elijah Grace. One of the things that I wanted to add to some of the things that Dr. Mason was talking about, and he did mention a movie, and I think the movie he's talking about, or was talking about, because I did see it and we did some screening when I worked with him at the city, called Forks Over Knives. Forks Over Knives. That's the name of the movie, and I'm sure you can find it. But it does speak about the foods we eat, and it might be a way for people to get a better understanding of their relationship to good health and the foods that they eat. But moving along, and we got about 20 more minutes to go, I'm going to toss a question to Dr. Miller. Dr. Miller, in your practice, and you were an internist, right?
Correct.
So
Yes.
what were the things, and what was your frustration with patients? Because I'm sure that you talked to them, but what was your experience like trying to talk to patients and helping patients change some of the behaviors that they had that made their disease worse? Because that's got to be a very frustrating thing.
It can be, I think, but that's where having some understanding of culture things, as well as just knowing how to communicate well with people, kind of lowers the amount of frustration that I encounter. And I think part of that, the congressman said that if we want something, we'd like to see it happen today. But being reasonable, we know that it might take a number of days before these things happen. But frustration comes when, for instance, I recall a situation. I had a patient who was a cigarette smoker, and I talked to him a number of times about, stop smoking. And usually, these would be, just part of our visit. And he eventually got cancer of his upper respiratory system. And so, we had a conversation and about, what was going on with him. And asked me, said, "Doctor, why do I have this cancer?" No. And so, it was kind of frustrating me to realizing and remembering all the conversations and the problem that I had talked to him about that occur with cigarette smoking. But that was the first question that he had when we talked about what the problem was. But I think that I was able to understand at that point there was a lot of anxiety on his part. When we sort of got through his level of anxiety, then he started to coming to some understanding of these are some things that have happened. I should have made some changes earlier. I didn't, and at that point it didn't make a difference with where we were. At that point we got to deal with what is, not what we wish the situation was. So those are the kinds of things that can be frustrating. And diet was always a very frustrating factor because people we all are creatures of habit in a lot of ways, and so people tend to start eating certain things and they like that, and so now if they eat according to their taste buds, and so if that's guiding them, then oftentimes they don't consider the health outcome from the food that they're eating. So those are the kinds of things that can be very frustrating. But again, I think it's a matter of having the time and also having the necessary help that you need, because as a practicing doctor, you only have a certain amount of time that you can sit down and talk to these patients about their diet and also get them evaluated and do the things that you need to do, because you otherwise you wouldn't be able to take care of the number of patients that you need to take care of in a day. So those were some of the frustrating things that we have to deal with, and but getting folks to change their habits, that's a very difficult task to really try to undertake, and people will ask you to they sit down and honest ask you, really, what do I need to do? What do I need to do to lose weight? What do I need to do to be healthy? Or what do I need to do to get more sleep? What do I need to do so that I'm having less problem, with my gut? And but getting them to understand that and to make the necessary changes is what is difficult. So it's not always not understanding what the problem is being able to carry out the solution to the problem. And I think one of the things that when I was listening to Dr. Mason, that I wanted to sort of mention, and we were talking about the money. When we put this whole thing into a closed system, and we look at the money in terms of healthcare costs, and we look at what it is that makes money. See, I mean, the question is in terms of what he was saying, it's not that there isn't enough money. It is who get the money. And if the pharmaceutical company is the one that's getting the money, then the problem is probably not being, then the management is not being done well, because now pharmaceuticals manage problems. It doesn't prevent problems. It just, it's doing something to try to keep things a little bit quieter than what they otherwise would be. It doesn't prevent people from getting high blood pressure. It doesn't prevent people from getting diabetes. So part of it is, how do we put the money in the right spot that is having the kind of effect that we want it to have in terms of helping people? And so part of that is education, putting more money into educating people, putting more money into the training process that we need in terms of a real healthcare system. I don't know how we get about how we get to the point of really, revamping the system so that it does that. And also getting the training, not just a training of patient, but the physician has to be trained differently. As physician, we were trained to be detectives of diseases and to try to control them, as opposed to being trained to figure out what prevent these diseases and be active with that. And if we had a system that would handle the cost of doing that, it would be a much better system, and we'll have healthier people.
Yeah, well, I'm going to jump in. We got about 10 minutes left, and move us in a different direction, because we can talk about the system all we want, but the system is the system we have, whether we like it or not. This is the system we have, and we need to help people better manage themselves in the context of a system that is not really favorable to them. So basically, I'm urging people to take charge of their health, because they play a role too. You can blame the system on a lot of things, but you can't blame, to some degree, the system for the choices you make in terms of the foods you eat. You have the option to make better choices in terms of food, and you could probably eat healthier for less money. That's particularly if you prepared more, if you bought fresh fruits and vegetables, if you bought your groceries and you cooked your own food, the food would be cheaper. But most people eat their meals away from home now. A lot of people don't eat meals. They don't prepare food at home. They don't know what they're eating because they don't prepare the food. The other thing is we lead very sedentary lives. And so what's happened over time, that has changed us as a population. We have a very real and significant problem with obesity.
Yes.
And I'm not saying it's a bad word. Let's just say that people are overweight, and they're overweight to the extent that it's going to cause health problems. A couple of things. One, I learned when I was working in the city health department that for every 10 pounds you have overweight, your blood pressure goes up a couple of millimeters of mercury. That might not mean a lot, but 10 pounds could cause you to have high blood pressure over time. It's insidious, but you might not realize it. So if you lost 10 pounds, 15 pounds, you might be able to lower your blood pressure. So there are some everyday things that people can do that would improve their health moving forward. And it's never too late to start.
Yeah.
You might not be able to totally reverse everything, but you can improve your health and your potential quality of life moving forward. And I want to mention that Mandine is back, and he's watching. He one of those he's watching and listening. And Regina Brooks, I guess, thanked me on making a valid statement. And she agrees with me 100%. I see Nikki has come back. And I just want to make one more point, and then I'm going to toss it back to Nikki to see if she has some idea where she wants to go. One of the things that occurred to me years ago is there are three things that derive our choice in terms of the foods we eat. The first is taste. When you're hungry, you want something that tastes good and you like. The other is convenience. How close is it? If you're in the house, you know what you got, but maybe you want to go out. How close? I know what I have a taste for. I want to get something that's convenient. And probably the most important thing is cost. And when you make food cheap, particularly food that you can eat outside the house cheap, you are more likely to leave the house and go get what you want. Maybe bring it back home, but a lot of people I see go to a fast food restaurant and they start eating the food before they leave the restaurant parking lot. If you pick up fries, you eat those fries before you drive off. Some people take the hamburger out the package and start chewing on the hamburger when they're at a stoplight because they can't wait to get home to eat. So all this is skewed from what we used to do, where we knew what we eat, we prepared the foods we eat. Things have changed dramatically, but we can do some things, and there's simple steps that each of us can take to lead a healthier life. But I'm going to toss it back to Nikki because she may want to reel us in or talk about direction, or she may have seen some comments that I don't, and some people that I haven't acknowledged.
Okay.
Well, Joe, those were really some really valid points, and I love it. And it's amazing how you talked about eating in the car before you can even get home, which has got to be stressful because how are you driving and trying to eat at the same time? And then sometimes some people like myself.
That's why you get red lights. You get a stop sign and a red light.
Exactly.
You gotta fry.
And some people like myself, if I do stop, which I have really broken that habit, but if I do stop, I want to eat it before I get home because I don't want to share it with my dogs because they are waiting for me to share my food with them. I cannot eat in peace. But in some of these fast food restaurants, you can get one of their meal deals, and it should stay, I'm not going to say their name, and the meal deal costs more than it would if you bought a bag of potatoes and cooked them at home yourself. So an order of fries now is like $5, $6. You can get a bag of potatoes and have as many of them as you like. So I just want people to kind of just think about that a little bit. I know you don't feel like cooking sometimes, but just take that potato, put it in the air fryer, go get ready for bed and go back and grab it. So there you go. There's always ways we can work it out. Joe, I thank you guys for this. And I think all of the men enjoyed a conversation just for themselves. So the men were really sending a bunch of thumbs up, wasn't saying much, but they were definitely listening. We got a ton of thumbs up. So now we're just going to do our Until Next Mondays. And I'm going to start with you, Dr. Mason. What's your Until Next Monday?
We ought to understand that, and this is real quick, that these things that clog up our blood vessels are those culprits that end up creating things like kidney failure, erectile dysfunction. Those are the things that create that. And it starts out with something that doesn't hurt, and you can't tell until you start looking at the numbers after things get bad. So we see your primary care doctor, because the only way you can find out if you got early diabetes is to get it. You can't guess, you got to get a test. The only way you can find out if other things are getting wrong, like your PSA for your prostate cancer, you have to get a test. So I want everybody to go get a test. Don't guess.
There you go.
Absolutely. And I want everybody to know that Dr. Mason has really broken my habit of eating jalapeno potato chips. So I just thought I'd share that. I haven't had any in probably 7 months. So thank you, Dr. Mason. Well, Dr. Miller, you're Until Next Monday.
Yeah, I'm just going to hit on this point. We got to, number one, learn patience, but also we got to learn to prioritize what is really important to us, and we should make certain that and not just from what we taste, but what is life? What is important to our life? Having a full life, a healthy life, being able to do things and spend time enjoying things. It requires us to be healthy. If you're sick, and you may have access to a lot, but how much you really enjoy it versus is if you were healthy and you would get you'd enjoy it a lot more. So as we talked about preparing meals. We don't plan a lot in terms of that. People don't plan meals. People don't plan. They don't say, well, I'm going to eat at this time, and I got to, I have an understanding, and I prepared for what I need to eat by obtaining those foods, and I'm going to prepare them in a way that it's going to be healthy, as opposed to waiting until I'm hungry. One of the things that I learned, and this I learned more so from my wife. She made certain that I understand. Never go to the grocery store hungry. Don't go grocery shopping when you're hungry. You're going to come back with the wrong things. So, prepare and make certain that you take these things into consideration. As you go through your day, you need to, just like you think, it's like you have a job to do. that's part of your job to figure out what it is you're going to eat, how you're going to eat, and how you're going to get some of the other things off of your life that cause a problem, the stress that you have, all these kinds of things, the care and concern that you need. How do I get that? These are a very important things that we have to prioritize and figure out ways to include them in our lives.
Outstanding. Want to say hey to Kathy Hayes. Kathy Hayes is here with us. So is Bridget. Bridget is here with us just as well. Dee is here with us. Hey, Dee. How are you? How are you doing? Dee, it's great to have you here with us. And to Terry Winston and Nikisha Hobbs, who is also here with us. Regina, I see your question and I love it. We are on every Monday night at 7 p.m. That's from 7 to 8 every Monday night, except for holidays. And on holidays, we actually run a rerun. Feel free to answer any questions. You can also inbox us with any questions you may have, or if you have any comments in reference to a subject in reference to healthcare that you would like for us to talk about. So thank you so much. So Joe, you're going to be challenged tonight, not only to give us your until next Monday, but also to close us out. Just want to remind everyone that this is still flu season and COVID is still here. So make sure that you have all of your vaccines up to date. And to always remember to wash your hands. Wash your hands. Remember when you're touching doorknobs and the shopping carts, and also going in and out of doors at your workplaces, or even when you get into your own car. Who knows who's touched your car handle along the way? Just remember to wash your hands. And if you feel like you're in a place where you are not safe, meaning people are sneezing and coughing, just put a mask on. I keep a mask in my coat pocket all the time. And when I'm around and people get to coughing, I put it on. And I always wear a mask in the grocery store because you never know what's going on in the grocery store. Go, Joe.
Well, I'll end by telling people I sort of backed into public health and healthcare. That wasn't what I started out to do, but wound up having a rich career in both public health and healthcare. But one of the things that I learned along the way is what not to do, what things could cause me to be sick. And so, what I'm a strong proponent of, and I think what we've been talking about, is healthy habits create a healthy life. So, you may not be eating right now, but you can change that. You may not be exercising or moving now, but you can change that. You have the power to change. Your doctor can't change you. You can make better decisions. You can adopt better habits moving forward. And what will happen is you will become a better person. And so, my last thing, and the last thing I want to say is healthy habits lead to a healthy and long life.
Good night.